Hello, everyone, and welcome to the Brownstone. I'm your host, Dr. Michelle, and you're listening to Numbers Don't Lie. We learn to get out your feelings so you can make the best decisions for yourself, your family, and your business. Well, guys, you have come at the right moment because you are smack dab in the episode that I am doing with the panel of Black women doctors. They have expertise across the field of public health. They touch it, they live it, they understand it, and they're here to really impact change to get the information that you need into your ears so you can make a better decision. We're going to pick up where we left off. I'm going to allow them to introduce themselves, but if you are just tuning into this one, I would definitely encourage you to go listen to the episode right before it because it'll give you more context to frame this conversation. We're really just talking about preventative health in the Black community and the barriers that we're seeing. I showed a graphic from the Kaiser Family Foundation that really just talks about the different disparities that we see across the gamut of health, from cancer to the actual age of death. It really doesn't matter, and we have to do something about it because no one is coming to save us. So let's bring our panel of guests right on back, and I'll allow them to introduce themselves. Let's switch it up a little bit. Dr. Jasel, could you introduce yourself?
Hello, everybody. I am Dr. Jasel Martin. I am a public health scientist, researcher, and professor. I'm also the founder of the Viv Wellness Academy, which is a comprehensive wellness practice. And I'm also the founder of the Heal the Public Collaborative, which is a nonprofit geared at increasing health equity in communities of color.
Awesome. Dr. Haynes.
Okay. Hi, everybody. Dr. Venice Haynes here, also a public health researcher, professor, and social scientist. And I have the pleasure of listening to people all over the country about what they want and need and the pain points of the health system at my position at United States of Care. And we'll get into this a little bit later, but we'll talk about how you can find me and definitely want to make sure that your voice is heard as we try to improve healthcare and this health system for everybody.
Awesome. And Dr. Lines.
Hi, I'm Dr. Lons. I am a neuropharmacologist and professor at Meharry Medical College. I'm also the CEO of Butterfly Girls, who we do a lot of public health initiative kind of things in reaching the community. But at the heart of it is really a women's and girls health and empowerment organization. And like I said before, my whole life, work and hobbies and everything kind of revolve in this public health space. So I'm glad to be here.
Awesome. So we're going to pick up where we left off last time. We were really just talking about barriers to health, and we talked about a gamut of things: diet, exercise, decision making, and then stress came up because everyone is always so stressed. I'm just so stressed. I'm so stressed. Let me just say, please stop saying to yourself that you're stressed. Stop feeding that to yourself. But Dr. Lon, she had a great perspective, and I want to let her share.
Thanks, Dr. Michelle. I would like to say, well, start with two things. One, the first is that stress, so just the etiology of stress in your body, when you're stressed, your body is expressing or releasing cortisol. And cortisol is a hormone that literally changes your metabolism in every area. So it has effects on bone health. It has effects on your insulin levels or your what is it, your insulin resistance, whether you're insulin resistant or not, how your body processes insulin, glucose, cholesterol, anything that any metabolic process in your body, cortisol is going to affect in some kind of way. So if you're always stressed, then you're always compromising your metabolism.
So in layman's terms, as you said a whole bunch of words that maybe everybody doesn't understand, how does it play out in these different conditions? Because I understand what conditions they are, but
Right.
maybe everyone else doesn't.
So if you're always stressed, then that means you probably always have a compromised high blood pressure. You
Mhm.
might be inhibiting your gut's ability to absorb sugar, so now your blood glucose is high. You may be affecting your body's ability to break down or metabolize the fats that you're ingesting. So if you do have a poor diet, then you are doing yourself a disservice and additionally being extra stressed because your body's ability to break down, process, metabolize any kind of fat, be it the good fat or the bad fat, your body's compromised in the ability to metabolize that. And as a result, you're putting your complete being into this um, position of being just having your whole your physical health well-being compromised. And then the stress has a whole different effect on your mental health as well,
Mm.
because that cortisol also, your body releases cortisol, but that release of cortisol controls whether your body is able to release oxytocin, and all of the good hormones that we want to release. Your body's compromised in being able to release those as well. So now you're depressed, or and these other things, because you're not able to release the right amounts of dopamine, or to feel that the happy feeling. You're not feeling love, but your body isn't
Mm.
able to excrete or release oxytocin and all of these other things. So stress has a physical effect on your body and a mental effect on your mental health, and it's all mediated by cortisol, and cortisol effects on hormone levels. And that's another thing that you can mitigate with exercise too. So if you're exercising, then I think it's after 15 minutes, you're allowing your body to come out of fight or flight mode,
Mm.
which is what stress is. Your body, if you're in stress, you're telling your body that it's fight mode, right? So your
Wow.
adrenaline is rushing, and so you're completely compromising your sympathetic nervous system, and your parasympathetic nervous system isn't able to override it. So now the thing that's supposed to bring you back to your zenful place is not. It doesn't have the proper control that it should supposed to.
Let me tell you, Dr. Shalonda is super smart. Now, she said some high level stuff, but I hope you were able to follow what she was saying and like really trying to help you understand what's happening inside your body. Because what I took away was when you're constantly in fight mode, like imagine walking through life like this all the time. This is what your body is doing, because Dr. Haynes mentioned that survival mode. That's what this is. And it's like look how tight I am. Like you are
Right.
uptight. Your body's literally uptight all the time. And you're probably not able to get enough rest, because rest is another way for you to rejuvenate and come, another day. Like your body is really recovering from the day. So it's so many things that's also interconnected. But the whole mention about what we're talking about is try to reduce your stress levels. We're talking about what are those prevention things that you can do to prevent disease and all these things we see. Lowering your stress level, eating the proper foods, diet, exercise. So these are things that you can do no matter where you live, because Dr. Sell told us last time, do what you can wherever you are. If Whole Foods is not beside you, what is beside you? Okay, well, look at the ingredients while you're there. So you can do some of these things that's in your power and your ability to do.
Absolutely.
Absolutely. Yeah, and Dr. Lawrence touched on some really pivotal points. I would even say, I would add into that everything that she just mentioned with the stress. It all creates inflammation, and inflammation is the root cause. Well, stress is the root cause, but inflammation is the primary contributor to pretty much anything that's chronic, any chronic related condition, whether it's cancer, hypertension, diabetes, even some neurologic conditions, all kinds of things, or even extra tension in your muscles, or pain in your knees. That's typically inflammation in certain muscles, and it causes muscle imbalances. So it all stems from stress. And even with the exercise, even though it's called eustress, which is the good stress, too much of it can still be a bad thing. So you want to make sure that you're doing things in moderation for your body and your lifestyle. As it comes to exercise, make sure you're stretching, make sure you're clearing out all of that lactic acid. But I wanted to also mention with the exercise, because so many people, when they go ham, they go in, right? But thinking about just long term and the therapeutic impacts of exercise, most people, when they exercise, what they really want to do, aside from the therapeutic mental benefits, is let's face it, they want to lose fat, right?
Mm-hmm.
But most people go to the gym with all the super hardcore, they're going to HIIT class and all this other stuff, which is considered zone 4 and 5 of cardio. And so this is me putting my exercise physiologist hat on. If you want to burn fat, you need to stay in zones 1 or 2, basically. And those are the low VO2 max zones. So typically you're at roughly 75% of your heart rate maximum, which, well, anyway, we use a formula called the Corvonin formula to calculate this. but that's a whole other conversation. We'll talk about that later. If you have questions, just let me know. But that is roughly, and this is what bodybuilders and boxers and all these people who are super, super ripped, they understand this. They keep their heart rate pretty low. That's why you see them walking. They're on the Stairmaster. They're doing things that are going to mobilize fat and burn fat more than glycogen. And so anyway, doing too much of high intensity exercise is going to keep you in fight or flight mode too.
Wow.
So doing this lower level of exercise, even, it actually makes you better. Like when you do, like, let's say, like for instance, I do HIIT 1 day a week.
Mm-hmm.
When I do HIIT, because I have been training in zone 2 for the rest of the week, I actually perform better in my high intensity exercise, and it makes me more equipped to actually be in that fight or flight mode when I need to. And so your body needs to be able to react. But when it is chronically taxed and engaged, that's when it's the problem. And so you want to be mindful of that even in your daily lifestyle habits and choices.
That's good. So what I heard is, oh, go ahead.
I was going to say, Dr. Jasel, so would you say too that helps with maybe the sustainability of exercise longer, and kind of like, I feel like sometimes if you go too hard, too fast, you burn out faster, and then you don't want to come back to it because you're like, oh, I hurt so bad, I was in pain, and you just kind of burn yourself out on that, versus if you start slow and kind of sustain it.
You are absolutely right.
That's good.
I was going to say to that, it also feeds to that reward pathway in your brain that, there, like, to be able to one, learning, but also to want to repeat something, it has to have some kind of concept of reward. And if you are burning your muscles and self out, and then you're hurting, and like, you're supposed to have a little soreness, but if it hurt to where you can't move the next day, it's actually triggering a different part of your brain, and it's cutting that off. So you're like actually blunting an actual part of your neurophysiology that's you're supposed to want to be able to do this again. And if you're going ham for the lamb, it's not going to happen.
Did you know that data-driven organizations were 19 times more profitable? 19. You heard me right. Perhaps you're asking, what is data-driven and how do I become one of those organizations? I'm so glad you asked. I want you to go take a quiz. It's a simple, quick quiz to help you assess if you are in fact one of those organizations. Head over to mogulbeginnings.com/data into dollars quiz now. That's mogulbeginnings.com. You just go to mogulbeginnings.com and it'll show you the data into dollars quiz. Take it now. You'll see if you're on your way to 19xing your profitability. You're listening to Numbers Don't Lie on KCCR Cityscape. We hope you're enjoying the tunes and all the jams. Make sure you visit our website over at brownstoneworldwide.com to learn about all things Brownstone. You can check out Brownstone Living Magazine and all the great things that we have on the website, as well as the shop. You just got to head over to the website, brownstoneworldwide.com. All right. This conversation was great. The ham to the lamb comment, like, even though I think y'all it's very evident that these are very smart women, but I want you to get the takeaway that what they're saying. Start with where you are. Like Dr. Jasel talked about being in that zone of exercise. Like, you don't have to do the most to be effective for your body. Because I think that's always, like, people always like to point out their limitations when it's time to do something good for themselves. Oh, like we talked about the last episode, there's no healthy food near me. It's too expensive. It's this, it's that. Well, walking is free. A light jog is free. Push-ups in your home is free. Crunches is free. So these are just very minimal things that you can do. I do mini stepping. And I put my little video on YouTube. I get on my mini stepper. That's like, I didn't make it to the gym today, but I can still do something. So start with where you are, because we're really talking about breaking down those barriers for preventive health, because that is how we see that age gap of life expectancy close, because there's no reason why our community is dying in their 60s and 70s. We should be living to 80s and 100s. There's no reason why our community is contracting STDs at a higher rate, dying with cancer at a higher rate, being diagnosed, going to dialysis. I mean, it's heartbreaking. Like, as an epidemiologist, it's heartbreaking. It was very hard being a student in an epidemiology program. For those of you that don't know, epidemiology means the study of disease. So it's very heartbreaking to be in programs, to see graphs and hear figures and to read paper after paper after paper of how our community is finishing last.
Yeah.
And at some point, we have to say enough is enough. Take control. So we're hoping by this conversation, you're learning how you can take control. What are those slow and steady things that Dr. Jasel just said? Those slow and steady things you can do every day to turn the needle in your family and then integrate it into your complete lifestyle. So instead of a generational curse of diabetes, instead of, oh, we always eat like this, now it's, oh no, like we have healthy blood pressure. Like, I remember that happened to me one time, y'all. I give blood quite often. And the technician, they was checking my blood pressure. He was like, you have excellent blood pressure. That's now going to be the legacy of my family. We have excellent blood pressure. We're not going to be riddled with all these chronic conditions that we have the ability to change. Anybody want to say anything about it? I'm gonna get off my soapbox before we move on, but that's I had to say that.
I mean, this could be the whole rest of the podcast. I mean, just saying. But I think the ultimate takeaway that almost every one of us has said to some degree is sustainability is the key. Whatever just decisions you are making, think about what the long-term ramifications are. Just because you want to go out there and you want to start moving your body doesn't mean you got to go run. Because guess what? I mean, this is technically a data podcast. So data-wise, running actually puts 10 times more pressure than your body weight on your joints. So you talking about your knees hurt and you going out here running, whereas walking is only 3 times more weight on your joints. And it actually burns fat, whereas running burns glycogen. So, just simple things like that. But I think it was Dr. Lons who said in the previous episode, if you don't know what you don't know, right? Mm-hmm. And so that's why you are empowering yourself and you're listening to people like us who are trying to help just provide little nuggets, and these little changes over time are going to make some really big changes. We're out here breaking generational curses, people. So,
okay. And it starts with you. I want to switch gears just a tiny bit and talk about, because we talk about barriers, like, things that we can do. But I really want to talk about, because Dr. Haynes mentioned like access. And then once you go to some sites, the experience is not always the same there. So I can edit that out. I'll edit that out. But I really want to talk to access, like those barriers to access and getting to those places. So whatever comes to your mind, let's talk about access.
I think about this a lot because we're working on a aspects of access, and I'm going to try to get this out because every time I say it, I can't get them all. So for those that are not in the public health space, when you talk about access, they're called the 5 A's. Accessibility, availability, affordability, acceptability, and accommodation, right? So when you say access, that can mean that can fall in those 5 categories. Most of the time, we're talking about accessibility and affordability when it comes to access, right? How am I going to get there and how am I going to pay for it, right? And so that could mean a lot of things. It could mean food deserts, or you're not in proximity to grocery stores or walking paths or areas where you can, or neighborhoods where you can, walk safely. It could also mean to healthcare services, right? And we're talking about this, we're talking about prevention, and I'm thinking about one of the best things the ACA did, the Affordable Care Act, aka Obamacare, for all of you that know Obamacare. Okay, They made preventative services free. So the first episode, we were talking about all of the screenings and vaccinations and all of that. One of the things they did in the Affordable Care Act was make those things free. Once upon a time, you used to have to go to your primary care physician and pay your copay and pay out of pocket for those things. They got rid of that.
Mm-hmm.
I will also have you know that that is now back on the chopping block in the health policy. Braidwood versus Becerra, and we're working very diligently. We're trying to keep that into the healthcare package and make sure that not only for the ACA, but all health plans continue to make preventative services and screenings free. That is critical because that was a major barrier, affordability to people getting access to those screenings, colonoscopies, mammograms, pap smears, you name it. So that is critical, right? When we control all the things that we can, we have to go out there and get to those things. At least we can make sure that those things are free. So I'll say that. But there's a lot of times we have to overcome a lot of other things. You have to think about your day to day. You have to take off work to do those things. Like the doctor's office is open the same time your job is. So who came up with that? I don't really know, but right. And so there are clinics, there are offices that are trying to make accommodations for that. Back to those 5 A's, right? You see where I'm going? But we can't let that be a deterrent. We have to find workarounds to be able to fit this in. So I know we're working on a lot of different things to make sure we just have the basics to be able to get to. It may be harder for some than others. But to the extent that you know people in healthcare or that can connect you to where you can go to get these preventive services, even if it's a checkup, when we say you don't know, you can't make a difference if you don't know. A lot of times we won't go to the doctor on purpose. One,
because we don't want to know.
Because you don't want to know. You don't want to find out. Right? Oh, my grandmother died of cancer. Had diabetes. I don't want to know. I'm gonna die of something. We can't do that. You can't take that approach, right? And it's better that you know where you are, with all of your stats so that you can do something about it and catch things early. Here's another big one. What I hear a lot, especially people of color, especially Black folks. We don't trust folks in the healthcare system.
I might have to leave on that one.
And that's going to take us probably in a whole nother.
We'll be back for that one, y'all. We'll have to come circle back.
Bring me back on that. I can on that and the whole systemic layers of that. But we're working even to address some of those things too in the system in terms of not educating providers, but there's a lot of different considerations that providers need to have in terms of who is coming into their doctor's offices from different cultural backgrounds that need certain accommodations, right? If somebody might have English as a second language, right? Everybody is not a monolith and might need personalized treatments, but that also can't be a deterrent. Make that provider come in with your list of questions before you get there and make sure they get answered. If you need to bring somebody with you, go that extra step to advocate for yourself. Like Dr. Michelle says, nobody is coming to save you. They aren't. If you don't ask, they're not going to answer. They will make assumptions. Yes, all of these things are happening, but we have to go that step forward, unfortunately, to ensure that we are heard, that we get our questions answered, and we come away knowing what we need to know about what we need to do.
That's good.
Dr. Michelle, bring me back because I'm going to take over the rest of the podcast.
Okay. Anybody else jumped in, but that's good right there. I just went to the doctor this morning. These are questions that I literally asked the nurse practitioner who's a Black woman because I intentionally seek out Black providers because I want to be heard. But yeah, we're gonna be talking about maternal care, so that's definitely gonna come up. So you guys have to make sure you stick around for our quarterly episodes about that. But go ahead, Dr. Lons.
I was just agreeing with my good Maharian sister. I think this is part of the conversation that is ingrained in how we're trained on all spectrums at Meharry. And I just want to say something that I told my students last week. We were teaching hypertension last week. And I asked my students to raise their hands. How many of you guys have family members that have high blood pressure? and then, are they diabetic? I want to say like 90% of the class raise their hands. And then I ask them, as doctors in training, do you know what your people are taking? Are you able to tell them, have you done the work? Because you're future doctors. This is practice for free this is practice for free for y'all. What have you suggested to your family? Because now you're the trusted doctor. Right. And so one of the things that we can do, especially in our circles, and I do it for my people, and I'm quite sure everybody on this call does the same thing, is I've taken time throughout my workday, and I'll be on the phone with my family members as they're at the doctor, so that I can make sure that they understand what's happening to them when it's happening to them. And so we become like, it's a burden kind of to some people. It's not a burden to me, but we have to take on a burden within our communities when it comes to being able to trust what the doctor is saying. For those of us that are in this sector, we just have to take on that, burden of making sure that our people are going to the doctor, and when they go, that they understand. I think one of the things of that is they don't understand what the doctor is telling them.
Yeah.
But then going to the doctors, they told me something. I don't know. I don't know what it means. So what did they tell you? And most of the time they can't tell you. All right, well, can you give me access to your charts? You know what I mean? That kind of thing. And I go back and like, girl, you got your cholesterol all over the place. Stop eating fried chicken. Like, what does this mean in our community? I think some of us can just take the burden of just like being that interpreter, so to speak.
That's good.
In these spaces.
I'm so glad you said that, because we do. When I say that, find if you can call a doctor, if you know a nurse, if you know somebody in the medical field, to just run something by them. Yes. And yeah, we do need to take that on, for our people, just to have somebody to bounce things off of. That's real.
Because I think sometimes people think when we talk about health literacy, because I'm like fully invested in social determinants of health, and a lot of times we say health literacy, a lot of times people may think about, well, they don't speak English as a first language. But that's not always the case. Like medical, like I, with a PhD, I was looking at my medical charts. A lot of people don't even go like look at that stuff once they write it in. I'm like, no, what are you saying about me? What did you put on my record?
Exactly.
Because I told him, I said, you need to take that off. That's not true. I didn't say that. Or that's not the right code. But that's because I'm knowledgeable and I understand. Exactly. But even looking at it, I'm like, I don't know what these means when they, get your blood levels and they look at everything. Like, you just gave me my results, but what does this even mean? So it's nice to be able to know somebody, be in close proximity to someone. So if that's you, niece, because that's, they call you, hey, niece, come here. If that's your niece, if that's your sister, if that's your grandchild, it's okay to take on that burden to help your elders or your friends or your neighbors out, because we really have to rely on each other.
Let's let that be a call to action. If we are in the healthcare field, like I will challenge any Black folks that are in the healthcare field, take this on. Help us educate each other on what our doctors are telling us.
Absolutely.
Yeah.
Giselle, I think
I have a personal story about this, actually. So my mom, I remember I asked her the results of going to her nephrologist, and I mean, at this time, nothing was wrong, whatever. She's like, oh, he said such and such and such. And I was like, well, that doesn't make any sense, Mom. I was like, okay. So I was like, I need your medical records. I get her medical records. This woman has full-blown CKD. She has stage 2 chronic kidney disease. I was like, Mom, why you didn't say nothing? Because I was like, wait, does you eat certain things? And I know as a clinical nutritionist, there's certain things you are not supposed to eat with CKDs, and every stage is different. And so we changed her diet. And at this time, I hadn't met any of her doctors or anything. Her numbers were completely different from one visit to the next. And he was just like, what did you do? What is happening? Yeah, her potassium was different. Her phosphorus was different. Like, everything was different because she was eating according to what her lab results said. And I mean, because my mom's 70
but
years old.
No one communicated that to her. That was no one gave her the call to action. No. And that is a little bit part fault of the the way the system is created, whether it's they're trying to rush or whatever the case may be. So that's why we talk about that burden. Sometimes we have to take on. I don't know everything, but I know how to Google.
Exactly. But even sometimes it's like, some people don't know even that much, like they're just, okay, well, if it was that bad, my provider would have told me it was that bad. But what's interesting is, and this is why you need to have, I believe in comprehensive care. So anyway, going back to the story, her provider ended up calling me because he wanted to know, what have you done with your mother's health? But this is going back to what I was saying about comprehensive health care. You need to, every single person, you need to make sure you have the appropriate physicians and clinicians, because not all of your clinicians are going to be a physician. I believe everybody should have access to a nutritionist, somebody who completely understands what is happening with you. Because and this representation matters. Representation matters in policy making. It matters in day-to-day healthcare delivery, and it cares as far as advocacy as well. So speak up for yourselves.
Absolutely.
This was so good, y'all. Oh my gosh. I know the listeners learned a lot. So could you guys tell them where to find you? We'll start with you, Dr. Lons.
You can find me everywhere, anywhere, on any day and time, on Instagram, social media, Dr. Lons _Marie. And yeah, any derivation of that.
Awesome. And Dr. Haynes?
I think the best place to find me, where I'll be most responsive, is LinkedIn. You go to LinkedIn, type in Venice Haynes. I should pop right up and I'll be there.
Awesome. And Dr. Jasel?
All right. You can meet me on Instagram, Facebook, anywhere, at Dr. Jazzy Fit, or on my website, drjaselmartin.com.
Awesome. And you guys know you can always find me, Dr. Michelle, on all things Mogul Beginnings. That's MOG. If you Google it, everything will come up. So thank you guys again for listening in. Just stay tuned for our next panel discussion. This happens every single quarter. So I can't wait for you guys to hear the next one. And then let us know how this has helped you, what else you want us to talk about, because we want to do our due diligence to educate our community. Make sure you check us out also on brownstoneworldwide.com to know about everything that's happened to Brownstone, because this is another place where we tell our stories our way. Until next time, guys. See y'all.